Citing another report, a report of the Fraser Institute, that says that expenditures in healthcare are unbearable. They're asking you to stop these transfers to the provinces and even to establish a 5-year moratorium on the healthcare system to allow provinces to include a private healthcare. So since they're asking for a stop in the exponential growth in healthcare, should it be your responsibility to do so?
There was one person in the healthcare industry who did have a conscience. Dr. Linda Peeno, a former medical reviewer at Humana.
My name is Linda Peeno. I am here primarily today to make a public confession. In the spring of 1987, as a physician, I denied a man a necessary operation that would have saved his life and thus caused his death. No person and no group has held me accountable for this, because in fact what I did was I saved a company $500,000 for this. And furthermore, this particular act secured my reputation as a good medical director, and it ensured my continued advancement in the healthcare field. I went from making a few $100s a week as a medical reviewer to an escalating 6-figure income as a physician executive. In all my work, I had one primary duty, and that was to use my medical expertise for the financial benefit of the organization for which I worked. And I was told repeatedly that I was not denying care, I was simply denying payment. I know how managed care maims and kills patients. So I'm here to tell you about the dirty work of managed care. And I'm haunted by the thousands of pieces of paper in which I have written that deadly word, denied. Thank you.
How did we get to the point of doctors at health insurance companies actually being responsible for the deaths of patients? Who invented this system? How did this all begin?
Spending priority, because Canadians are clear. In terms of government spending priorities, the healthcare system is their #1 concern. They want to make sure we continue to finance it. I think everybody understands we've got to get better results to that. For that, we're going to sit down with the provinces and see how we can do that. But everyone is committed to continuing a universal public healthcare system that is fully financed. That is this government's #1 spending priority, and that will be its position.